The Be Fit for Health radio show was previously recorded. The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha, this is Be Fit for Health. I am your host, Bianca, and it's another great day on Sunday here in Hawaii. And I just want to say thank you so much for taking the time to join in and to listen to us. I just wanted to let you guys know it's a little bittersweet show for me. Hopefully I won't get emotional on any of you guys because this will be my final show for a bit of time. I am going to be taking a break and hopefully we'll rejoin you guys with Salem Media back to the same topics of discovery of our options when it comes to our health and well-being. But I will be still around. Just to let you guys know, I will have my YouTube channel that will still continue to educate and give you guys some things to think about when it comes to what we can do to increase and I guess make our health more efficient so that we are living a quality life that we want. So, without further ado, my last show, you're going to wonder what topic I picked. And I've asked a few friends what they would like me to talk about. I'm going to discuss, because it's been a while. I mean, I haven't brought on my buddy Scott Osgood for a long time. It's been at least 7 months. And I want to talk about our fur babies' health. I mean, a lot of you guys are pet owners out there, and a lot of us are confused because our animals don't talk back to us. I mean, they do in their way, but they don't tell us what's going on with them because they can't speak our language. They try to give us telepathy and they try to send us out energy vibrations. But, some of us are dense and we don't get it. So, I want to kind of talk about some things on the show when it comes to our health of our fur babies. And the only person that I could think of that would give us sound advice is my buddy, Dr. Scott Osgood, who is in fact, someone who's really educated. And I think if you guys don't remember his bio, his background, not only did he get his veterinarian degree, he got his major in biology, minored in computer science. Really? I mean, getting your degree wasn't enough in veterinary. You're too smart for us, man. Undergraduate was in Baldwin Wallace College, but then his med school was from Tufts University, so he really toughed it out. That wasn't funny, was it? Okay, I'm sorry. His internship was at Angel Memorial Animal Hospital in Boston, Massachusetts. So he's well-rounded. He's traveled the U.S. to get his degrees and his education and his experiences, but he had decided to bring it back to Hawaii and, help our babies. So thank you, Scott, for doing that. I appreciate you and adore you. So
Aloha.
Welcome.
Absolutely. I'm happy to be here.
How'd you like me picking on you on our radio show?
Right. That's okay. It's a radio. Nobody knows what I look like.
No, they should. You're a good looking guy. No, but you know what? It's crazy because I decided to make my last show on our animals because a lot of our well-being also is derivative of the wellness of our animals because they're like our children. And when our children are not well, as you know with me, I get stressed out, and stress isn't good for our bodies because it makes us not well. So, I wanted to bring you back on
Absolutely.
to talk about, what we can do as moms and dads of our fur babies to get them to a place of at least functionality without having them suffering too much. Because we really don't know how much they're suffering, do we?
No. Most people don't know. You kind of, you got to use your mommy instincts, but I find there are like two classes of clients. The ones who go way overboard. In other words, a cat throws up once and they're running to the vet.
Are you talking about
the
me?
child is throwing up at home. No, I'm just telling you. You can put yourself in whatever basket you want, Bianca.
So wrong.
But we let our children sort of, throw up or whatever. We're like, here's some Pepto, go lay down.
Right.
But the cats and the dogs are rushed to the vet because they throw up once.
Right.
And then there's the class of clients who that just don't understand the pet's personality enough or what's going on, and that things get kind of put on the back burner a little bit. And then it turns out to be really, really serious because animals typically try to hide their illness, so it's not quite as expressed as they might think it is. So they're hiding it so they don't really show up. They don't go to the vet early on, so we have a lot of backtracking to do on those animals a lot of times when they're really sick. A lot sicker than people know.
Yeah, by the time you take it to the vet,
it's fall in the middle.
Yeah, well, yeah, it's true. But I mean, I think I'm more in the middle to the extreme because of the fact that that if your animal is starting to show signs, it's already far gone from the beginning stages. It's probably towards the middle to the extreme exchange of illness.
True in a lot of cases.
Yeah,
absolutely, because they hide the beginning because they're still eating and they're drinking and they're socializing.
Right.
And, maybe they're just a little off, and you kind of you don't think much about it until things get serious. Especially when the animals stop eating. By the time they stop eating, a lot of times there's probably significant stuff going on.
Yeah, or they're sleeping a lot more. Even though cats sleep a lot, let's say, and dogs do too, but cats more so. If they're sleeping a bit more than they normally would, or just kind of quiet, and they have that look on their face of like, you kind of have to start picking up those. I mean, unfortunately, you know what? The luck for me with my animal is that I was home due to COVID, and most of us were. But when I lost my job due to the closure of the Honolulu Club, I got to stay home a lot more than I normally have since I've had my cat for 12 years. This is the first time I've actually spent a lot of time with him, and I got to know his personality and his ways. And then I started seeing these little signs of the way that he would eat or wouldn't eat, or the way that he would moan when he got up. I mean, he's getting older, but when he starts moaning and his purring starts changing, that's another sign too, right, Doc? I mean, if the purr kind of becomes more frequent in cats, let's say, and then we'll talk about dogs, versus the gurgling sound versus the way that they normally would purr like a motor.
Yeah, I mean, it kind of depends. A lot of that depends. But, some cats will purr more when they're sick. They're needy. One of my cats is very old, and she's got a few things going on, but she's 16 years old, and every now and then she's just so needy and purry, and you just know that, something's up with her when that happens. And then there's the opposite. There's the cats that just become aloof and they go hide in the bathroom, or they go lay in a corner or something. And obviously that's an odd behavior. So it just depends a lot on the personality of the cat. That's why you got to kind of know your animal. And I think you're not alone. I think a lot of pandemic pets are getting a lot more attention these days because people are starting to spend more time, and the pets are thrilled, and they're sort of seeing these routines like you talk about, that they didn't necessarily knew what the animals do all day while they're working.
Right. Yeah. But what about dogs? So what are some of the signs that dogs, because I know cats hide well, but what about dogs? What would be a good clue for us to understand that an animal like a dog would be suffering? Besides, I mean, they're more apparent when they have joint issues, but what else can we look for if there's like cancer or IBS or any type of organ dysfunction?
Yeah, it's hard to nail it down to one thing because they all have their own sort of disease entities, so they'd all sort of show up in different ways. But dogs typically are a little bit more of a stoic animal. Cats like to hide their illness and that, and they kind of, they just kind of go through it. But they tend to show up eventually and show something's wrong. Whereas dogs sometimes, being man's best friend, they may not actually say anything. Unless they're Chihuahuas. Chihuahuas tend to just keep talking. If they're sick, they let you know it right away. But so we start to see, not finishing their food rather than not eating. They just kind of maybe slower eating their food, or maybe they're not the first one to the door to run out anymore, bouncing like they used to. And usually it's a sort of a quicker change. Cats are very gradual a lot of times in their diseases. The old cat diseases, kidney disease, thyroid disease, even diabetes sometimes, can be sort of a gradual onset. Usually there's not anything that sort of hits the wall and they're normal one day and they're sick the next. Dogs, on the other hand, depending on their problems, they tend to sometimes just do a 180. One day they're good and the next day they're not eating or throwing up or they're laying around. And, just because of the nature of the kind of diseases dogs get versus cats. They share a lot of diseases, but there are a lot of things that are just much more common in cats, and there's a lot of things that are much more common in dogs.
Right. I mean, there's a saying that, like you're saying, if a cat throws up, for example, because I own cats right now. I've always had dogs too, but I mean, right now my animals of focus is a cat. Is that a cat can throw up once in a blue moon, especially if it's like hair and things like that, right? That's normal. But my cat started to throw up every other week or so, and it was becoming to the point where I'm noticing this wasn't a normal thing. And when I took my cat to the vet, and also to you as well, because it was easy because you come to my house. That's why you're great, mobile vet guy. You're awesome. So when you guys do these tests, and we find out that he had IBS, um, and then it could turn to IBD, which is are two different things. Yes, doc. I mean, it's like IBS is a symptom versus the IBD is the disease. Correct?
Cool. Not necessarily. Your cat probably has early IBD, is what they were saying. IBS, irritable bowel syndrome, is it's a not well understood entity in animals as it is in people. In people, we know there's direct relation between stress and how your sympathetic nervous system works, and it sort of cramps up your gut and your colon, and all of a sudden, you have diarrhea because you're all stressed. And some people have that severe, and some people have milder cases of that. There definitely is a syndrome in animals of IBS, especially small dogs. They go to the kennel, and every time they go to the kennel, they end up in diarrhea, or fireworks go off, and now the animal's throwing off and has diarrhea. Cats, most cats, I would say, probably have IBD.
Okay.
Just very mild cases of IBD, which isn't necessarily IBS.
Okay.
Yeah, so I think there is a distinction there, and I'm not sure that one goes to the other, but anytime you have chronic inflammation in the body, it leads to other diseases. So if you have IBS, say in people, and you have chronic inflammation because you're always stressed out and everything's always happening down there, it can lead to other things in your gut. Animals, it's much harder to sort of put that connection together with IBS, but we do know that chronic inflammation anywhere else in their body leads to other things. We worry about, cats with IBD. Over years of having IBD, or inflammatory bowel disease in cats, can lead to lymphoma, which is a cancer,
right,
and other things because of the chronic inflammation that's in their gut. It's not an immediate thing. It's something that usually takes years, and we usually suspect years down the line, if they end up with lymphoma, that it was probably as a result of this chronic inflammation, which we may or may not, in all honesty, be able to control well.
It's just weird to me because so for example, if a cat's diet may be the cause, or what would cause lymphoma in a cat? The inflammation, you said? Or is it just something that's
lymphoma,
genetically?
or you mean?
Yeah.
Well, lymphoma there's not a lot that we know that necessarily causes lymphoma. We think of lymphoma as just a cancer like people get. In cats, it can be related to feline leukemia virus, feline immunodeficiency virus, the FIV virus in cats. Those viruses can lead to lymphoma, but 99% of cases of lymphoma in cats don't have those viruses.
Right.
They just get it. And sometimes, especially if it's GI lymphoma, it can be secondary to chronic IBD, whether we knew it was there or not in cats sometimes. We can ultrasound a lot of cats,
right,
and give them all an ultrasound diagnosis of some sort of IBD, and it doesn't necessarily mean they have the disease.
Right.
And the reason is because you really need GI biopsies to know if they truly have the disease or not, in most cases. So that's why we don't hunt a lot of things. We look on the ultrasound, which is what they did with your cat, and see those mild signs, which may or may not be relevant. But again, given your cat's situation, everything that was going on with your cat, biopsying the GI tract is not the best step. It's not in the cat's best interest to go through that, to chase that down when your cat had other issues anyway. We knew it wasn't really his problem per se. It was just exacerbated by the other issues going on.
Yeah, with his kidney dysfunction. I was going to ask you, can a functional gastrointestinal blood work be more efficient then to do to measure out his B vitamins of his bodies? Because if he has inflammation in his bowels, he might not be able to absorb certain nutrients. Would that be something that you would do, or
if he had chronic soft stools or diarrhea?
Yeah, he does.
Because if you have that, then we worry that maybe the B vitamins, the folate, are not being absorbed the proper way.
Yeah.
And they have to be supplemented, and they can't be supplemented oral because they don't absorb them. So they have to be supplemented as injectable. So in a chronic diarrhea case, yes. If the animal had ultrasound signs of IBD, but didn't really have any soft stools or anything like that, it'd be highly unlikely that he was short vitamins.
Right.
Because if you don't digest your food properly, those larger proteins that aren't broken down and everything else drag water with it, and that's why they have diarrhia. So if they don't have diarrhea, there's a good chance they're breaking down their food properly. They just have other things going on.
Would
if that makes any
probiotics,
sense.
would probiotics help then at this point? Like if my cat's been having soft stool and diarrhea for the past 2 months now, and even though he's on his budesonide and stuff like that, it's still not regulating itself. So I've been giving him probiotics every single day in his food, but it's not seem to be working. So what would you suggest to someone who is having still issues with the cat having soft stool or diarrhea?
Well, I certainly would say probiotics and prebiotics as well. I definitely think measuring B12 levels is not a bad idea. B12 has a lot of functionality, and if they're low, then you're going to have more chronic diarrhea as sort of a feedback circle on that. So, but it's not going to fix the problem. It's just fixing the rest of the cat's health.
Right.
Also, diet is number one.
Right.
You know, your intestinal lining gets its nutrition from the food, not from blood supply in most cases.
Right.
So if your diet is not appropriate for the disease that you're on, then your gut is not getting the proper nutrition itself. So it is important in those animals, you know, if they have chronic soft stools, to make sure that they have the right kind of fiber in their diet. Those kind of things, just to sort of calm things down inside a little bit more. It just makes things a little bit healthier. And fiber is a prebiotic.
Like sweet potato or pumpkin, things like that?
Sweet potato. I use canned pumpkin a lot in cats because a lot of cats like it.
Not mine.
So we use, well, that figures.
Yeah, it is what it is.
Yeah, but I mean, you can give them anything that you would think is a good source of fiber. I think pumpkin's just a really concentrated, healthy source of fiber, so that's why we use canned pumpkin in cats. It's hard to get them to eat sweet potato. They're not much potato eaters.
Right.
You can also supplement their fiber with, you know, fiber substitutes like we give people. The problem is, you know, you mix those with water and it turns into a gel, and the cat doesn't like it in the food, and so that's why we tend to avoid Benefiber and all that other stuff that we do in people, because cats just won't eat it. So we have to sneak fiber into cats.
Yeah, but what about dogs, though?
Foods too.
Because what if
dogs are much easier?
Oh, well, yeah, that's a given. I mean, but it's like, but if your dog is chronically having soft stool, and even though if it's, you know, you're able to feed dogs a lot easier than cats because cats are finicky, but dogs will eat pretty much anything. What can you feed your dog, or what can you do besides probiotics for your dog? Because if you've done all these things and he still has diarrhea, what would be the underlying cause? Food allergies?
Well, we don't know the cause. I mean, trying to treat it really depends on what the cause is, because there's many types of things that will cause diarrhea in dogs. So we have to narrow down, you know, where we go in order to know how to treat. Things that you can do in general that won't hurt probably anything are fiber, prebiotics, postbiotics, that kind of stuff. Never hurts to change the food. Food allergies are a common source of chronic issues in dogs. So we try to avoid, you know, major common proteins like chicken and beef and wheat and corn and soy and dairy, and we feed them weird foods like salmon and rabbit, and there's a kangaroo food out there.
Yeah, those kinds of things.
Bison, venison, and those are usually mixed with sweet potatoes or some other kind of either legume or beet pulp, things like that as a fiber carb source within the food, and it stays away from rice and wheat and corn as the carb and fiber sources.
Yeah,
because we know that they're allergies, and they can be, you know, not really well tested for food allergies. You kind of have to just do it. And there are dogs that are allergic to the things that we recommend for food allergy dogs. There's no great way of sort of, you know, putting our thumb down and say, okay, you're allergic to this, this, and this. We don't know. So we just avoid like the most common all at once. Try something else at the same time, adding some fiber in and other stuff and seeing if the dog sort of resolves after weeks of new food.
Right.
But there's many, many things, especially here in Hawaii. There are so many foodborne illness and bacterial issues that cause chronic gastroenteritis here and stuff. So there's a lot of fecal testing that we do on these dogs, more so dogs than cats, that are PCR testing for chronic salmonella, shigella, Clostridium, C. diff, all these things that, we worry about in human hospitals with people who have surgery that are sort of nasty bugs that go around, are very common here in Hawaii, and dogs eat everything on the ground. So sometimes we have a direct cause, and, if one of those things shows up on a test, great, we know how to treat it. Here's a bunch of antibiotics, usually a combination of things, food fixing, and then things generally get better in a couple of weeks.
Yeah, it's tough even with the antibiotics, even though the antibiotics helps the situation, then you have to now fix the lack of good bacteriums in their gut to balance out
You do,
that.
which is why we always we always add in those prebiotics and those postbiotics at the same time.
Yeah.
You just can't give them with the antibiotic. That's kind of a big mistake people make, is they want to give their animals their probiotic and their antibiotics in the same meal. And what happens is the antibiotic pretty much kills the probiotic, and he's just eating his food. So we try to separate them out throughout the day and give one, in the morning and one at the evening, and at least do it a little bit better that way.
Yeah, it's a challenge.
But there's a lot of fixable things.
I was going to say, how do you gauge the level of like reaction when it comes to their gut health? Because their gut health is basically the start of any other possible diseases that could happen in their body, right? Because if their gut isn't formulating properly,
we gauge it all.
Go ahead.
Go ahead.
No, I was going to say, what would you recommend that we do to start off? Even let's say we rescued a middle-aged dog, so how would you start with that? How would you start with that animal to support their gut health?
I would just start in the beginning. You don't really have a history on those animals because you've just adopted it, and we don't really know if it came from like a malnourished history or whether or not it was just given up, but it had a good time before then. It was eating proper food and that. So generally, we just start off with trying to make sure they have a good quality food, that they don't have soft stools. We often screen them right away for a lot of these parasites and make sure they don't come with any freeloaders.
Right.
Because that'll certainly say. And then, there's a commonality to stress of a new environment that, when those dogs come into the new environment, we try to give them a little fiber supplement and stuff, because that's where things like these irritable bowel things come in, because now they're in a new home and they're stressed. And if they're one of those dogs that are a little anxious and that kind of stuff, they're probably not going to have the best stools for the first week until they kind of settle in, and stuff. So you can help those dogs by giving them, you can give them probiotics and prebiotics, but usually it's the fiber that helps those dogs the most, because it stops gut contraction a little easier.
Yeah, it's a challenge. What kind of probiotic would you recommend? Is there a brand that you use on most of your animals?
No, there are veterinary brands, but you can use human brands. They're really the same. A lot of the advertising on these probiotics, when it says, I have 5 million colonies or 10 million colonies, it's a little bit of a ploy because these bacteria are replicating. So it doesn't really matter, if you have 5, 10, or 8 million colonies in one capsule.
Right.
It's all going to do the same thing. So you can use those on dogs. Generally, depending on the dog's size, we would give you to give them a half a capsule or a full capsule, human stuff. But they make it in dog versions, that are chewable treats and things like that, or powders you put on the food just to make it more palatable for the finicky dogs so people don't have to pill them,
right,
and stuff. But pretty much most of them across the board, in all honesty, are kind of the same. So I don't get too worried about feeding them necessarily a name brand or something like that, because I'm not really sure paying twice the fee is really going to worth the results you're going to get.
Can you overdose on giving probiotics to an animal without having side effects?
You could, but it would take a lot. Like, you couldn't overdose it if you accidentally dosed the dog twice in the same day. That's not going to overdose a dog. But if a dog ate a half a bottle full of that, you have so much of that other bacteria coming in that you're going to crowd out a lot of the species of bacteria in your gut that actually you still want to stay there.
Yeah.
The goal is to crowd out the bad bacteria, but it doesn't matter how good your bacteria is. If you're going to load your gut up with it too much, then you're going to push out some of the things that really we need to stay there, because your gut is a community and you need everything to be working properly. All the species of bacteria all provide something down there, whether it's breaking down certain kinds of food material or creating vitamins that we're going to absorb, or anything else. You need the whole community to be functional, and you can't get rid of one section of that.
Good. So what would be a toxic situation for because we're talking about overloading anything, what would be a toxic detrimental situation for a pet, like a dog and a cat? Like if they were to consume something or inhale something, obviously Clorox, you don't want your animals to go near Clorox or any of these detergents, but as food wise, what would be a no-no to feed your pet?
A no-no. There are a
Absolutely
lot of
no.
no-nos.
Oh,
Yeah. Here in Hawaii, I mean, my biggest concern a lot of times really are a lot of the plants we have around here. You get puppies and they eat these. People have these plants, these beautiful plants in their backyard, and they get a puppy, and it turns out these plants are highly deadly, and puppies chew things. So plant toxicities probably are more common. Food toxicities, we always talk about chocolate. Chocolate's a little overrated. It just has to be. If it's really dark chocolate, then it contains a lot more of the toxin. And if the animal's really small, then the dose obviously could be less to cause signs. So chocolate's one of those things that there's a big spectrum depending on what they're actually eating. Things that people don't think about a lot here in Hawaii are things like macadamia nuts. Macadamia nuts cause a temporary paralysis in dogs.
wow.
We don't know why. We don't know what the
I didn't know
toxin
that.
is. Yeah, a lot of people don't know that. But, when we get dogs that are just down and they look like, they're weak and their nerve function is low, and they don't really have any other signs that we really know about, first thing we start targeting is, is it possible this dog got into macadamia nuts? And if that's the case, we support the dogs. They almost always recover. So it's not, in most cases, a life and death situation, but it's dramatic because the dog literally can't walk.
Wow.
They go down.
Any other nuts?
So macadamia nuts. What's that?
What other nuts
No,
are there?
not so much. It's just really macadamia nuts. None of the other nuts really seem to have any real toxicity. It's just macadamia, and it's not even like the chocolate coated. It's just the fact that they're eating macadamia nuts.
Wow.
But then we have onions. So onions cause anemia. There's a toxin in onions that causes your red blood cells to explode. So in cats and dogs, obviously they don't need a lot of onions to cause what could be severe anemia. So we have to watch giving them things that have either real onions in them or onion powder, which is just concentrated. So that's a danger here.
What about garlic?
That's kind of No, garlic's not really that toxic. Even though it's kind of in the onion family, it's really not that toxic. People used to give it a lot of times for flea preventions as a natural flea.
Right.
It's been proven not to really work. But it's not going to hurt them to give it. But we tried, and we keep trying these natural things, and then we try to test them and see whether or not there really is any validity to it. And a lot of them there really isn't. But again, if they do no harm, I don't mind. Some people swear by it, but scientifically, we have never really proven those things to actually do anything.
Instinctively, I've been very cautiously giving, my cat cooked, protein, but there's cilantro on there. So I would take the cilantro off because I'm not sure if cats are can't deal with cilantro. Is cilantro toxic to pets?
As far as I know, it's not.
Okay.
No, I don't think so. No.
It's a different type
I would have, at least in my 27 years, I probably would have run into a cilantro toxicity. Don't think so.
Well, maybe you're Chihuahua.
I know.
Who knows?
Right. We hear a lot about it in Mexico then, right?
Right, exactly.
All this salsa.
Yeah.
Yeah.
That's crazy.
No, it's not. It shouldn't be. But onions, and then we have to think about grapes and raisins. Huge toxicity potential, rare. There are dogs that eat grapes all the time over in Napa. They literally walk up and down the grapevines eating grapes, and they're fine. But there is a toxin in grapes that on a rare dog will actually send them into acute renal failure. One grape
Really?
will cause your dog's kidneys to die. Yes.
Is it the skin
So
or
we
the
think there
the
has
meat?
to be no, it's just the entire thing.
Wow.
Because raisins also are highly toxic for the same reason. And that's why, if you call the emergency clinic and say, my dog ate a grape, they're probably going to get you in there right away. They're going to try to make the dog throw up, and then they're going to give them activated charcoal to bind any toxin in that one grape. And then they're going to put them on fluids for 24, 36 hours and monitor their kidney function.
Wow.
It seems like a really big deal to do because your dog ate one raisin or one grape. But if you can't get that grape out, you have to make a decision. Okay, am I going to be the 1 in 100,000 dogs who's going to go into kidney failure? Or am I going to be one of those dogs that could eat grapes all day long and not have a problem?
And how many of
you
us
don't know
feed our
till it
animals
happens.
grapes? I mean, as we eat grapes, they come over and begging to you and you give them a grape. You don't
A
even think
lot
about
of
it.
people do.
Yeah.
Yeah. I would never give my animals grapes, even if I knew, my dog, ate a grape before and didn't have a problem.
Right.
We don't know enough about what sets these dogs off and the toxicity in these
There's
grapes.
genetics.
We just really don't know enough to make it safe to either say these are safe for my particular dog or not.
Right.
So I'm a never grape,
Why
never
take a
raisin
chance,
person,
right?
ever.
Yeah.
Yeah, you don't want to. You just don't want to take that chance. There's so many other things in the world to give your dog. Just avoid it like the plague.
What other one? That's really that's a new one. That's really impressive. What else that we think that is healthy for us that we feed our dogs and cats that we shouldn't be doing?
Well, I mean, in general, I'm not a big fan of dogs and cats eating people's food regardless for the most cases. The fat that we eat in our diets just is so unhealthy for a lot of dogs.
Oh yeah, the trans
Especially
fats. Yeah.
small dogs.
Yeah.
Yeah, they just can't handle it, and they end up with a lot of pancreatitis and other very life-threatening conditions just because they can't handle the fat.
Yeah.
So when we feed them table food, we're never really, being very particular about we're usually giving them a piece of red meat or something cheesy,
Right.
or, because that's kind of what we feel like, oh, it's just a little bit. But, you have a 12-pound dog who's eating, a couple teaspoons of macaroni and cheese is like sitting down and eating 3 cartons of butter for us.
Nice.
It's a lot of fat for a chihuahua.
Yeah.
And it will cause a problem eventually. So I just think people should, if dogs like dog food and you want to supplement your dog with something, then you stay with healthy stuff and feed them in the bowl, not at the table, so you don't have one of those dogs that are begging and jumping on tables and things. And you can do that because I understand everybody wants to give their pets, a little bit of treats here and there.
Right.
But you have to understand the psychology of the pets is that, if you do it at the table and you do it enough, then the dog is going to get that behavior. If you don't do it to your dog, he doesn't really know what he's missing. Dogs don't think like that. They don't think like, oh my God, I'd really, go for a cheeseburger today. They only know it because you're waving it in front of your face. That you have it, and then they don't know what it tastes like until you give it to them, and then they kind of want it again next time they see it.
Like human beings, you want that again and again. What about something like salmon, though? It's good protein, but it's also got good omega-3s. Would that be too much of a high fat for the pet?
No, they're healthier fats. I wouldn't necessarily give the skin. I would stick to the meat itself. But they do make like dried salmon skin. It's kind of a treat these days. I think for cats, they bag it. Yeah, they'll dry it up and put it in a baggie, and then they use it as cat treats things like that.
It's got to be better than the other treats, though, right? I mean, because some of the treats that we give them has like wheat and stuff in there, and what is it? Some byproducts of some kind of protein. It's not even real protein. It's like all the crap that goes into making some of these cat foods.
Yeah, it's basically, salmon jerky. I mean, there really isn't a lot unhealthy about it other than the smell. But, if the pet likes it, I'm fine with things like that. Again, there's not really a lot of diseases that I would say you couldn't give, salmon to or something. You just have to be, know if your animal has particular needs in their diet and things that they can't have. Then you just want to not tip the boat. You just want to stay away from things just because.
Is there a diet place that people can go to for ailments and diseases? Let's say, like with my cat, he's got kidney issues, right? And I've understand what I need to do, but most people out there may not. So where can people go to get, besides their vets, because some vets may prescribe a certain type of food, what have you, from their clinic. But if someone wants to learn how to make the food from home for their pet, learn how to put the right type of nutrients so that the cat isn't deficient in balance in their meals, where can they go and look up for advice? Is there a book? Is there a website that people can go to? Is there anything that they can? Because
There's
people are going to do what they're going to do.
Books here and there.
Yeah.
Yeah. I mean, cooking for cats is a much different beast than cooking for dogs. There are recipes all over the place for dogs. Cats, on the other hand, are much more tricky. They are obligate carnivores, which means that they need meat and they have deficiencies in their body that they can't produce certain amino acids like taurine. So when you home cook for cats, it involves a lot of gross body parts, which usually are things like hearts and some livers
or the
and
thighs
things
of
to get
chicken
that taurine.
Yeah,
things like that. But with that also comes foodborne illness. So when you're giving cats raw meat, because they're carnivores, they like to sort of harbor these parasites in their gut, and then pass them on in their stools or licking each other's bums, and then they come and lick the person or something. So we worry about cats as being like this major vector of disease, even though they look so cute. But so if there's somebody in the house, especially that is immunocompromised, say somebody that's on chemotherapy, somebody who has HIV/AIDS, really elderly people that just don't have great immune systems in general, those are the houses I really would worry about people home cooking or homemaking raw food diets. They really should be on cooked food diets just for the safety of the people in the house, because it's really hard to separate, the animal from the people, so that they can't get contamination, because the animal is a part of the family. So if they are eating, raw chicken parts and that is part of their diet, and they have salmonella, and salmonella just doesn't like to express itself in animals. It just kind of hangs out and it passes through, and then the cat comes and licks your face. You know how people like to respond to salmonella. It's pretty severe. The cat just passes it through and then tries to kill us. So, and maybe that's the cat's plan. I don't know. Some of these cats are devious. I think some of these cats want us out of here.
You know what? It might be a plan, universal plan. You never know. They might want to take over the world. I can see that happening with my female cat. She seems to be maybe the leader of the pack. Who knows? Very mischievous. But no, actually,
that's because George is so laid back.
He's too laid back, man. This cat's a lover, but my female cat is she is crazy. But yeah, I make the raw food for her, but not for Georgie. Georgie gets the prescribed.
Well, we've discussed that before.
Yeah. But she's fine. But
you're doing everything right.
Yeah. She's fine, but he's like I said, I'm trying to do the best I can with the probiotics. Even though his diarrhea thing worries me, because I have to give him fluids now, Scott. Every 4 days, I give him the fluid in the injectable, which seems to help quite a bit. And that seems to keep him in check. But at the same time, I got to figure out how to stop this soft stool situation. And his diet is not bad. It's actually pretty good. He might be one of those cats that has these symptoms, but he's very active still. He still eats. He doesn't have any lethargic. He still fights with the female cat, runs around, chases her and stuff. So he's still very active. So for me, those are good signs. So I'm not too worried. But when you have a cat that throws up twice a month and has soft stool, there's still something wrong, that I need to get a handle on. So I don't know what else to do except I was thinking about doing a fecal transplant. We have a few minutes. Tell me what your thoughts are on fecal transplant for someone who may be having a constant diarrhea.
Yeah, I mean, a fecal transplant really is only useful if the cause warrants the treatment. In other words, a fecal transplant is not going to help an animal that has chronic pancreatitis, and that's why it has soft stools. It's not going to help an animal that has food allergies and has soft stools. It is going to help animals that their GI system is all screwed up because they've had parasitism or other diseases that have screwed them up that literally we just want to reset the colon. The problem with fecal transplants in animals is it's a little more barbaric than it is in people. In people, they give you these capsules that you eat, and there you go. You've pretty much done it. In cats, they basically harvest feces from another cat, which may or may not really be screened really well as the problem for certain things, like all these bacterial diseases, C. diff or whatever. So you could be essentially giving your cat something worse than it already has. We just, there's no fecal transplant list safe of cats. We don't test these cats and say, you can be a donor or whatever, because cats' life, they're out, they eat things, it's changing all the time. But I think there's a place for it. I don't necessarily think that I recommend it for most things, because most of those things we can sort of do otherwise, with certain bacteria or combinations of other things to sort of set the gut a little right without taking the risk of doing an actual fecal transplant.
Yeah, I mean...
Yeah, and they have to be sedated and all that kind of stuff in a lot of cases.
And you may have to do more than once,
too,
right?
To go through. I think you only really have to do one. It's kind of just feeding the gut with this new bacteria is all it's really doing, and trying to reset it. But it's a pretty, like I said, it's relatively new in veterinary medicine.
Right.
And again, that's just because the nature of the beast we're dealing with, and where we would get this, supposedly clean feces necessarily, to actually use for the transplant. So we don't really have a source for that. So people are using, other cats. And, if you're just going to use somebody's cats, whether it's an indoor cat or not, you really should test that cat for pretty much everything under the sun.
Right. Yeah, I know my vet's swearing by his cat that he uses for all fecal transplants. And he says, my cat's really healthy and da-da-da. So I don't know what he does to see if his cat is a good donor. But I would think with any donorship that if you want to help an elder cat, you would go to a kitten type or a younger cat who would have a stronger immune system, a stronger cellular system to help the older cat reset its biology to some degree, because you are bringing in new cultures into the body, right? Because we are made of more bacteria in our bodies than we are cells. So what do you think?
Yeah. A young, healthy cat, a young adult cat would be much more appropriate than a young cat.
Yeah.
I would say a young adult who's got everything sort of figured out in there already. Nothing
like 3
screwed
years
up
old.
yet. Yeah. Anything, I would say over a year.
Yeah.
But, cats, they eat their food, they step in their litter box. So what they're shedding today may not be the same as what they're shedding a week from now, regardless. That's why, trusting a donor is a little bit of a faith.
Yeah. So it's tough. It's like I said in the beginning of the show, our animals don't talk to us. They do telepathy. I mean, I don't know if you do telepathy. Yeah. I understand telepathy, don't you? I can.
Right. I think I would if I could.
You are the what do you call that? Animal doctor that travels from place
animal
to place.
Whisperer.
Yeah, you are.
Yeah.
You look at the animal going, he's fine. He's joking. He's lying. Yeah. He's pretending.
If telepathy means hissing and lunging at me, I got it. I read it.
You got the book. You wrote the book.
I got the message. Yeah.
That's too funny. Well, any last words of advice to the people out there before I tell them where to find you and how to get a hold of you if they need to? Your wisdom is great.
I think that, most people, my advice would be really is consult your veterinarian. And that sounds like a very simple thing, but you'd be surprised how many people come back after a month of using Dr. Google and diagnosing their cats on their own and doing things and sometimes harming their animals by giving them human medication because they read something on the web somewhere.
Right.
So if you're looking for sources and you are going to try Dr. Google, make sure you're looking at sources that come from reputable veterinary hospitals or teaching hospitals especially usually have the best website advice. So, there's 29, I think, veterinary hospitals in the country now. So if you're reading something and it's coming from one of them, then you can pretty much think that it's a reputable source. If you're reading something from Joe Schmo's dog fancy group because somebody tried something, I would be very wary, and I would definitely consult the veterinarian before you do anything that they've recommended.
Is there like a publication like PubMed.gov for pets, like veterinarians, that they can go look at the journals and publications?
There's nothing great that I think your average layman would want to read, in all honesty. Some of those articles you can find Googling, and they're from veterinary publications, veterinary research and stuff, and that. But for the most part, most of that is not an interesting read unless you know what you're reading.
Right.
There's not a lot of translation into layman's terms unless you're going, like I said, to an animal hospital site, in which case they'll reference, they'll break it down for you in a synopsis and that kind of stuff. And they'll reference the journal article probably at the bottom of the article and stuff, but at least they break it down for you, and just because it's made to be for the pet owner as opposed to the veterinarian. You don't want to read necessarily anything for the veterinarian unless you really have a scientific background or a medicine background and you're more interested in it. Then you can get all the bits and pieces that probably don't mean anything to most people.
Right.
And a lot of that stuff doesn't mean anything to me, honestly, when I read those articles. I just want the bottom line, was it effective? Was it not effective?
Right.
What's the drug?
Yeah, I don't need all the summary in between. Yeah, just give me the result.
Yeah. Sometimes I go right to the summary. I'm not going to lie. Sometimes you just go to the end and you say, okay, I don't care how many dogs, whatever, and just tell me, did it work? Okay,
great. It worked. Let's try that. Yeah, exactly. You and I are similar in that way. That's funny.
Yeah. I don't have a lot of time to waste on, reading the delicacies of the article.
Yeah. Who does? I mean, maybe some people, but who wants to do that, right?
Yeah.
So Scott, you gave me more time than you said, and I appreciate that because, this was such an important topic for a lot of people. And I know I took up some of it for my personal gain because, it's hard to get a hold of you because you're a busy guy. Everybody loves you and wants you. I know your business is called Island Mobile Vet, and your website is islandmobilevet.com. Is there a website?
Correct.
Okay. Wow.
Yep.
So brilliant. I know. So they can reach you from there,
I tried
right?
to make it easy,
Me too. BeFitForHealth.com. There you go. So easy. How hard is that?
Right.
Right. We
put
try.
like a number in there, right? You confused me. Once I tried to find it, I was like, it's not working, Bianca.
I'm sorry. I know. I got to say that, right? Yeah. BeFit number 4. See, that's a little too complicated. Maybe I should have made it easier. See? Sorry. I'll learn from you.
Bianca.com.
Well, thank you. I'm going to have, my usual YouTube on set, and I'll have all your information on there too. Thank you so much for educating us again about our fur babies. I know that this is important to a lot of people, and I hope that whatever we talked about helped people figure out a way to help their babies.
Yeah.
Thank you so much, Scott.
I think it's our job to educate them on how they can get answers. We don't necessarily have all the answers, but I just want people to get information in the correct way.
Yeah, exactly. Yeah. Google's great, but not so much. You should get it from an exact person.
Absolutely. Double check everything.
Don't worry. I'll text you a lot again. Don't worry. You guys don't understand, man. When I freak out, I'm texting this guy Sunday night at 9:00. He's like, Bianca, does he need to go to a hospital? No. Okay. Let's talk next week.
I'm going back to American Idol.
Oh, God. Well, bless your heart for that. Thank you so much for putting up with my craziness. I appreciate it.
Anytime.
All right, Scott, we're going to have to say goodbye to you here because I got to do my final goodbye to the audience. And before we do that, I'm going to go on a quick break, but I appreciate you. God bless you. Thank you so much.
Aloha. Stay safe.
You too. Bye. All right, guys, we're going to go on a quick 15-second break. And when we do this, it's going to be my last commercial for the next time I come back to Salem Media. So enjoy the commercial. I'll be right back.
You don't need to be a member of a gym to get your health and fitness